What's going on, guys? Tony Maritato here, physical therapist, and in this video I want to talk to you about how the JAS device can be used in standing to work on extension if you're just trying to get that last little bit of like 3 to 5 degrees of extension. So I'm sitting here, I'm at the kitchen counter. It's a pretty standard counter. There's cabinets in front. Now the device isn't really designed to be used in standing. Gravity wants to pull the device down to the floor. But I'm going to show you a little strategy that I would use just because I know it gets boring sitting there for 30 minutes with the device on and nothing to do. So let me show you what to do. You kind of give the device a little tug so it stays up nice and high. There's a rubber stopper on this end that I'm going to put right up against the cabinet door. And all I'm doing is I'm leaning forward into the cabinet. It's as if I'm walking. My non-surgical leg is back, my surgical leg is forward, my toe is just a touch underneath the kickboard of the cabinet. And so what happens is, as I lean into it, it creates a little added extension. It should be a very comfortable pressure. The device has given me pressure. If you notice in a previous video, I'm using the compression wrap just to kind of squeeze out some of the swelling, but then also bring warmth and stability to the joint. The compression wrap works great when you're trying to improve extension. It's not designed for improving flexion. But from this position, I'm leaning into the cabinet. I can be here. I can come down onto my elbows, my forearms. The whole idea is I've got this comfortable pressure pushing into extension while I'm bringing my hips forward. Maybe you feel a little stretch through the calf. Maybe you feel a little stretch through the back of the knee. I can maintain this position 2, 3, 5 minutes. I can do a little side-to-side rocking. This just gives you a little variety. You know, our bodies respond really well to altered sensation. And this is a great way to alter that sensation, feel something different, stimulate the tissue in a new way, besides just laying there with the leg propped on the heel. So guys, if you're looking for more ideas, if you want more information about the JAS device, the Joint Active Systems device, let me know, post in the comments below. I've got this unit, I'm doing a bunch of demo videos for it, but I'm happy to bring you whatever you guys want. I'll catch you on the next video.